So how did you become a hypnotherapist, and are there any specific qualifications you need?
Qualifications, how did I become? Years ago I went to a hypnotherapist and that got me interested, and about 95, somewhere around there, I was seeing someone, decided I was going to practice hypnotherapy because I remember what the hypnotherapist said. Hypnotized my girlfriend, and then afterwards realised I brought a lot of stuff out which I didn't know how to handle. So I decided I needed to get some understanding of what to do when somebody was in hypnosis. Because hypnosis is only a state that people go into. What happens in that state is the therapy side of it. And that's what I needed to learn. So in '95 I went on a 6 months course with somebody who was a hypnotherapist, learned the basics of it, wasn't satisfied, did another course between 1998 and 2000, 2 years, 1 weekend a month, and then in 2003 I did another course. So I've done about 5 or 6 courses along the way.
Okay.
And developed my skills that way.
Can everyone be hypnotized?
I believe everyone can be hypnotized. The fact is everybody drives, or that's been driven, usually end up saying, I can't remember this part of a journey, where they've driven from A to B, but they're missing out part of the journey and think, how did I get here? That's basically where they've gone into a state of hypnosis, and their unconscious mind driving the car.
Oh.
Sitting in front of a television and you zone out, you're not there, and you miss part of the picture. And you suddenly wake up and think, oh, what did I miss? That's again, a form of hypnosis. So everybody at some point has been hypnotized, they just don't know it.
Is it possible to hypnotize yourself?
Yes. One of my teachers on the second course, he was able to hypnotize himself, and he got there's a set of pinchers you can get from hospital that actually cuts, and he actually placed it on here in front of class and locked them in place, and the blades actually went into his hand, into there. Didn't cut into him, because in the state of hypnosis he's shut everything off. And yet it's also near it. So yes, you can be hypnotized. You can hypnotize yourself.
How do people know whether to trust a hypnotherapist or not?
I would actually personally say anyone that's actually looking to go to a hypnotherapist should check one of the registers, like the General Hypnotherapy Register, the National Council for Psychotherapists, and there are many of these governing bodies out there. And usually any genuine hypnotherapist will belong to one or a number of those bodies. They have a list of people they've actually, who's on their register, and they can go that way. Or they can trust their instincts. They go along, speak to the hypnotherapist and make a decision according to what that hypnotherapist is saying to them or not.
Okay. On average, how many people, like patients, do you receive in a week?
On average, I can see at present I'm seeing about 5 clients a week. When you begin as a hypnotherapist, the amount of people you see tend to fluctuate quite a lot. As you become more established and you get a lot of recommendations, you can be 10 to 15 clients a week, but it's seasonal. Because there are times in the year when people don't want to see a hypnotherapist. So like a lot of things, hypnotherapy can be very seasonal.
How long does treatment generally take until patients show a sign of improvement?
Patients have seen, most of them can show a sign of improvement within the first couple of sessions. You've had patients where after the first session, for instance, I had a colleague of mine who said this lady came in and said she doesn't want hypnotherapy, just psychotherapy. But we all know that when you're actually doing this thing, people go into a natural hypnotic state anyway, whether they realize it or not. And he read a certain group of questions to her. She went away. The following week she came back and she says, I don't know what you've done to me, but everyone around me seems to have changed. He said that to me, and I looked at him and he looked at me, because we know the only change that could have taken place is in her. Because she's changed, everybody else has changed. Which is quite amazing.
How exact a science do you think hypnotherapy is, and do you feel as though it gets less credit as a treatment as it deserves?
Yes, I do believe it doesn't get as much credibility as it should do. One, because it doesn't initially, there's nothing tangible to measure it by that easily, apart from the result of the client. It's seen as quackery because of how it was initially brought into. It was brought in by Anton Mesmer, who used a lot of theatrical tricks to it. Doctors, they're now beginning to recognize it. Hypnotherapy can be used in place of anesthesia. So under operations, it can make life a lot easier and a lot better. But it takes time to develop a client to that basis, where sometimes a client may need an operation immediately. So there's a place for it there, because it works with the mind. And I believe that the mind controls everything else. All the physical health problems and all that comes through the mind initially. And if you can get the mind right, the body's right.
Okay. What is the most common issue you've had with people coming into hypnotherapy?
Most of the people that come to me tend to be through things like anxiety. I've had a few where they've had sexual issues from childhood, and most problems start within the first 10 years of a person's life anyway, because that's where our foundation is generally programmed and starts. After that, everything else we have after is an addition. It's like building a house. You see, for youngs, they're pouring the foundation, the concrete, and all of a sudden you go past a week later and the house is up. So in effect, the foundation is what happened around age 0 to 10.
Okay. What do you think the main differences are between what the public see in hypnosis and what it really is?
Most people that you speak to about hypnosis will talk about what they've seen on television. And the television have quite a responsibility in how it educates the general masses. You get a lot of films where it's a watch that you see if you move forward. Or it's like, it's very theatrical, because television's entertainment. And obviously that's what most people see hypnosis as. The Paul McKenna's and the Darren Browns. It's fast, it's very dramatic, and it shows like quick results. They don't actually see what goes on behind the scenes before it gets to the camera. And that's what's missing, and therefore they don't see the full. When you come, stage hypnosis is one thing. It's for entertainment. When somebody says they're a hypnotherapist, it means that they put people into a particular state, and from there they work with the unconscious mind to deal with issues of emotional and mental problem that people may have. That could take a couple of sessions, it could take 10. It all depends on the individual, where they're at in their life.